Which of the following is false regarding the respiratory system of pregnant women? A. There is increased metabolic demand for oxygen from the body. B. The rib cage becomes slightly more compact. C. Total lung capacity decreases. D. Oxygen consumption is increased. E. The diaphragm elevates. The answer is B. The rib cage becomes slightly more compact. In pregnancy, the ribs start to flare, expand slightly, as the pressure from the growing fetus moves the diaphragm upwards. Many women experience this during the third trimester as the baby is at its largest. The flaring of the ribs is assisted by maternal hormones that enable more flexibility throughout the body. Which of the following reasons does not indicate the need to induce labor? A. Post-maturity. B. Diabetes. C. Fetal jeopardy. D. Fetal macrosomia. E. Gestational hypertension. The answer is D. Fetal macrosomia. Induction of labor may occur for various indications: diabetes, post-maturity, hypertensive disorders or pregnancy, fetal jeopardy, or logistical factors including distance from qualified hospital or a rate of rapid birth. Induction of labor may only occur if the mother does not have cephalopelvic disproportion, CPD, the fetus has a vertex presentation with an engaged head, and the mother has a ripened cervix or is prepared to be ripened. Fetal macrosomia is a concerning condition and may require intervention, but is typically not resolved by inducing labor. With fetal macrosomia, a cesarean section may be considered instead of vaginal delivery, due to the potential risks of delivering a large infant vaginally. What is the most common form of female reproductive tumor? A. Choriocarcinoma. B. Uterine leiomyoma. C. Yolk sac tumor. D. Endometrial adenocarcinoma. The answer is B. Uterine leiomyoma. The most common tumor of the female reproductive tract by far is uterine leiomyoma, also known as a uterine fibroid. Uterine fibroids are benign smooth muscle tumors that grow into the myometrium. They can often cause pain in the lower back or pain during penetration, dysmenorrhea, and menorrhagia. Sudden onset of severe abdominal pain with a unilateral adnexal mass would most likely be which of the following conditions? A. Polycystic ovarian syndrome. B. Teratoma. C. Pelvic inflammatory disease. D. Ovarian torsion. The answer is D. Ovarian torsion. While any of the conditions listed can cause abdominal or pelvic pain, the most likely cause of severe pain of sudden onset is ovarian torsion. This is an emergency condition which can result in loss of the affected ovary if not treated within 4 hours. Clear cell adenocarcinoma of the vagina is strongly linked to pre-birth exposure to what medication? A. Acetaminophen. B. Diethylstilbestrol, DES. C. Clomiphene. D. Thalidomide. The answer is B. Diethylstilbestrol, DES. Diethylstilbestrol, a medication used from 1940 to 1971 to reduce the risk of miscarriage, resulted in the later development of clear cell adenocarcinoma in many of the unborn children of these pregnancies.